Good evening to you, ladies and gentlemen. Thank you for giving me this opportunity to talk to you about simplification of DVT management. Simplification of DVT management is the need of the hour in a country like India, where a large number of people are affected by deep vein thrombosis. The incidence of DVT is common in hospitalized medical patients and surgical patients. The incidence and prevalence depends on the various risk factors and the age of the population. Autopsy studies have shown that in many cases, antemortem diagnosis was missed and in medical and surgical patients. In the initial trials, contrast venogram was the gold standard for DVT diagnosis. In the later trials, color Doppler scanning has become the gold standard for the diagnosis of deep vein thrombosis. A few studies have used advanced imaging such as CT scanning and MRI scanning for detecting the VTE. In 2012, in ENDOR study, Indian data was presented by our group. In this study, the risk of developing VTE in patients across the world was similar, that was to the tune of 50% based upon the ACCP criteria. That means every alternate patient in the acute hospital bed is at risk of developing VTE. But it was observed that the thromboprophylaxis was given in only 16% of the surgical patients in India, whereas it was much higher in Western countries. Risk assessment models were therefore introduced to identify the people at risk of developing venous thromboembolism. DVT can be symptomatic or asymptomatic, but both can lead to pulmonary embolism. They need to be treated with utmost care. DVT needs to be treated effectively. What does it mean? It should prevent recurrent DVT, fatal, non-fatal pulmonary embolism, without any risk of bleeding. At the same time, treatment regime must be simple to follow. That means keep it simple and safe is the logo. There should be no long-term side effects such as post-thrombotic syndrome, chronic pulmonary arterial hypertension, and so on and so forth. If we were continuing the anticoagulation, there should not be any type of bleeding complications. Overall bleeds, fatal bleeds, major bleeds, clinically relevant non-major bleeds should be less. And at the same time, the management of the bleeding should be simple and correctable. When the effectiveness of safety and are established, we think about home-based therapies over the hospital-based therapies. Patients can be treated with the comfort of the home. That is the whole essence of management of deep vein thrombosis in a large country like ours. The incidence of complications determines the need for more complex hospital-based therapies such as thrombolytics, endovascular therapies, and stenting. In general, we give injections of different types of heparin for a few days, followed by oral anticoagulation agents. We are also training our patients to take self-injections at home in this process. Treatments become simple if there is no need to monitor the effects of the drugs with blood tests and adjust the dosage of the tablet. There should not be drug-drug interactions, there should not be drug-diet interactions, and the conventional oral anticoagulants fail in this arena. If the patient must take medicines for months to years in this group, it becomes a concern for the patient and their families. Pharmacogenomics are helpful in some patients requiring unusual doses for the safe anticoagulation which is to be effective. When we ask the patients their choice of treatment, oral tablets is preferred by majority, but when there is no better other choice, they accepted the complex therapies such as thrombolytics, angioplasty, stenting, and so on and so forth. So, ladies and gentlemen, I simplified the information from all these trials, ENDORS, MEDINOX, PREVENT, Artemis, CLOT, SELECT, D trial, Einstein studies, Amplify, Stroke study, and then placing the information before you and the preferred choice of the patient. And my slogan is to start with a tablet stay with the tablet for a long period. Pop a pill, stay at home is the simplest treatment one can expect for DVT. We hope that it is possible for the majority of the patients. The next simplification is weekly once tablet of for DVT. Let's hope that is not too far. Thank you.